Hi everybody, I'm Dr. Cooper and I'm coming to you today with today's second half of how to recognize anxiety in my child. In our last video, we talked about how to recognize some of the different signs of symptoms that you'll see in anxiety and why it's important. And today I'm going to go into a little bit more as to the different treatment regimens that are available and why we choose what we choose, along with different things that you as the parent can do. Now, based on some of the questions that I had from the previous video, I want to remind you guys that the list that I provided, and I'll go over here in a minute or two, regarding the signs and symptoms is not an exhaustive list. If there are different things that your child is experiencing that are some of the things that I don't mention or am talking about, you can definitely give us a call at 480-847-0900, and I will specifically talk over and cover some of the different concerns that you have and tailor a treatment plan that is more in line with what is going on with your child in particular. So let us go ahead and begin. So some of the different signs and symptoms that I covered last time have to do with changes in bowel habits, bedwetting, not wanting to eat, abrupt changes in behavior, inattention, and a few others. So those are some of the things that I covered last time. And with those symptoms, I mentioned that it was important to recognize and understand that these symptoms may not be related to the child not wanting to do something in particular, but may be an actual sign of anxiousness that we need to cover. And just as a reminder, the reason why it's important to recognize and treat anxiety is because anxiety may lead to more severe things like panic attacks, depression, and unfortunately, in some cases, it can lead to suicide if it goes for too long, and it's just one of those unfortunate things that can happen. So we want to make sure that we as a community are doing our due diligence to recognize these signs and symptoms in our children so that they're able to reach and achieve the goals that they have. So we're going to go ahead and begin and discuss some of the different treatment modalities that we as pediatricians and other health practitioners use. I'd like to highlight that we as practitioners, especially in the pediatric realm, try to stay away from a lot of the different pharmacological treatments because your body can start to build up tolerance over time. And as your body builds up tolerance over time, you'll find that the amount of medication that you need is going to increase. And this can run a risk for some of the side effects and some of the detriments that can happen from an increased dose. So we like to stay away from those and use medicines in severe or very traumatic cases where we need the child to feel calm so that we can either help them to be able to move on or help them to be able to deal with something that's very anxiety provoking for them. So I won't go into specific treatments is related to medicines that we use, but I'd also like to highlight that there may be a few holistic or natural remedies that you can do, whether it's something as simple as chamomile tea. Those are things that can help your child to calm, can help your child to feel soothed. So those particular things are okay, and we definitely encourage you to go ahead and make use of those things. Now, there are a lot of different therapies that have been used over time. Some of those therapies include things like play therapy, cognitive behavioral therapy, applied behavioral therapy, and a few others that I won't be going into, but I just wanted to bring those to your attention so that if you hear those words, you'll say, oh, okay, those are some of the treatments that Dr. Cooper mentioned that I can use or consider for treatment modality for my child. And I also want to talk about different environments and different things that you can set up and you can do if you find that you have a child of your own that's dealing with anxiety or anxiousness. Now, in this particular example that I'm going to bring to your attention, happens to a lot of parents. They plan for that first day of school. They've even went to open house, and they have worked with their child because they've noticed that little Ashley does not do well with change. So they've done all of these particular things, but that first day still did not go as planned. So one of my particular examples that I always like to give is helping to bring out the positives. So maximizing the positives and sort of minimizing the negatives from that experience. So one way that you can do this is to plan your schedule and change it to where you can accompany them to school for a few days. Now, during these days, it's important that you highlight and you take time after the day to talk about what went well, what happened that wasn't so great, and try to problem solve and troubleshoot on how things can be done better next time. And by you talking about some of the positives, you can highlight and celebrate and help them to understand and to feel confident in knowing that even though this day didn't go exactly like I planned and it was unexpected, there were several wonderful things that occurred, even though it was something that at the beginning of the day I was worried about. So that's just one little example, and there's many more different things that we as parents and other family members can do to help to minimize signs and symptoms that can result from a traumatic experience, as meaning, now all of a sudden I don't want to go to school and my stomach hurts. So by us talking about those particular things, we can work together to problem solve and help to make sure that unexpected events and things that they're worried about will be things that are minimized and things that are treated to help to make sure that they don't spiral into something that becomes this debilitating thing to where they are not able to try new things and they are fearful. So I hope this video helps. I hope that you found that the information that I provided was helpful. Again, if you have specific questions that you have for your child, feel free to reach out to us. You can find more information on my website, www.foundationspc.com, where you can find our address. I'll also be posting some of these videos there for you to be able to look at future reference. But in the meantime, please like and share this video, and I'll be coming to you guys again in maybe I'd say in about a couple of weeks. You'll find the information on our next talk in the link below. So feel free to check back with my page, as I will be providing more information on different things that are affecting our community. And that's it. So goodbye for now.